Common patient positions. The following are the commonly used patient positions, including a description on how they are performed and the rationale. Supine or dorsal recumbent position. Supine position, or dorsal recumbent, is wherein the patient lies flat on the back with head and shoulders slightly elevated using a pillow unless contraindicated, e.g., spinal anesthesia, spinal surgery. Variation in position. In supine position, legs may be extended or slightly bent with arms up or down. It provides comfort in general for patients under recovery after some types of surgery. Most commonly used position. Supine position is used for general examination or physical assessment. Watch out for skin breakdown. Supine position may put patients at risk for pressure ulcers and nerve damage. Assist for skin breakdown and pad bony prominences. Support for supine position. Small pillows may be placed under the head to and lumbar curvature. Heels must be protected from pressure by using a pillow or ankle roll. Prevent prolonged plantar flexion and stretch injury of the feet by placing a padded footboard. Supine position in surgery. Supine is frequently used on procedures involving the anterior surface of the body, e.g., abdominal area, cardiac, thoracic area. A small pillow or donut should be used to stabilize the head, as extreme rotation of the head during surgery can lead to occlusion of the vertebral artery. Fowler's position. Fowler's position, also known as semi-sitting position, is a bed position wherein the head of the bed is elevated 45 to 60 degrees. Variations of Fowler's position include low Fowler's, 15 to 30 degrees, semi-Fowler's, 30 to 45 degrees, and high Fowler's, nearly vertical. Fowler's position has different variations. Promotes lung expansion. Fowler's position is used for patients who have difficulty breathing because in this position, gravity pulls the diaphragm downward, allowing greater chest and lung expansion. Useful for NGT. Fowler's position is useful for patients who have cardiac, respiratory, or neurological problems and is often optimal for patients who have nasogastric tube in place. Prepare for walking. Fowler's is also used to prepare the patient for dangling or walking. Nurses should watch out for dizziness or faintness during change of position. Poor neck alignment. Placing an overly large pillow behind the patient's head may promote the development of neck flexion contractures. Encourage patient to rest without pillows for a few hours each day to extend the neck fully. Used in some surgeries. Fowler's position is usually used in surgeries that involve neurosurgery or the shoulders. Use a footboard. Using a footboard is recommended to keep the patient's feet in proper alignment and to help prevent foot drop. Etymology. Fowler's position is named after George Ryerson Fowler, who saw it as a way to decrease mortality of peritonitis. Orthopneic or tripod position. Orthopneic or tripod position places the patient in a sitting position or on the side of the bed with an overbed table in front to lean on and several pillows on the table to rest on. Orthopneic or tripod position is useful for maximum lung expansion. Maximum lung expansion. Patients who are having difficulty breathing are often placed in this position because it allows maximum expansion of the chest. Helps in exhaling. Orthopneic position is particularly helpful to patients who have problems exhaling because they can press the lower part of the chest against the edge of the overbed table. Prone position. In prone position, the patient lies on the abdomen with head turned to one side and the hips are not flexed. Prone position is comfortable for some patients. Extension of hips and knee joints. Prone position is the only bed position that allows full extension of the hip and knee joints. It also helps to prevent flexion contractures of the hips and knees. Contraindicated for spine problems. The pull of gravity on the trunk when the patient lies prone produces marked lordosis or forward curvature of the spine, thus contraindicated for patients with spinal problems. Prone position should only be used when the client's back is correctly aligned. Drainage of secretions. Prone position also promotes drainage from the mouth and useful for clients who are unconscious or those recover from surgery of the mouth or throat. Placing support in prone. To support a patient lying in prone, place a pillow under the head and a small pillow or a towel roll under the abdomen. In surgery, prone position is often used for neurosurgery, in most neck and spine surgeries. Lateral position. In lateral or side-lying position, the patient lies on one side of the body with the top leg in front of the bottom leg and the hip and knee flexed. Flexing the top hip and knee and placing this leg in front of the body creates a wider, triangular base of support and achieves greater stability. Increase in flexion of the top hip and knee provides greater stability and balance. This flexion reduces lordosis and promotes good back alignment. Relieves pressure on the sacrum and heels. Lateral position helps relieve pressure on the sacrum and heels, especially for people who sit or are confined to bed rest in supine or Fowler's position. Body weight distribution. In this position, most of the body weight is distributed to the lateral aspect of the lower scapula, the lateral aspect of the ilium, and the greater trochanter of the femur. Support pillows needed. To correctly position the patient in lateral position, use of support pillows are needed. Sims position. Sims position or semi-prone position is when the patient assumes a posture halfway between the lateral and the prone positions. The lower arm is positioned behind the client, and the upper arm is flexed at the shoulder and the elbow. The upper leg is more acutely flexed at both the hip and the knee than is the lower one. Prevents aspiration of fluids. Sims may be used for unconscious clients because it facilitates drainage from the mouth and prevents aspiration of fluids. Reduces lower body pressure. It is also used for paralyzed clients because it reduces pressure over the sacrum and greater trochanter of the hip. Perineal area visualization and treatment. It is often used for clients receiving enemas and occasionally for clients undergoing examinations or treatments of the perineal area. Pregnant women comfort. Pregnant women may find the Sims position comfortable for sleeping. Promote body alignment with pillows. Support proper body alignment in Sims position by placing a pillow underneath the patient's head and under the upper arm to prevent internal rotation. Place another pillow between legs. Lithotomy position. Lithotomy is a patient position in which the patient is on their back with hips and knees flexed and thighs apart. Lithotomy position is commonly used for vaginal examinations and childbirth. Modifications of the lithotomy position include low, standard, high, hemi, and exaggerated based on how high the lower body is raised or elevated for the procedure. Please check with your facility's guidelines, but typically, low lithotomy position, the patient's hips are flexed until the angle between the posterior surface of the patient's thighs and the OR bed surface is 40 degrees to 60 degrees. The patient's lower legs are parallel with the OR bed. 2. Standard lithotomy position, the patient's hips are flexed until the angle between the posterior surface of the patient's thighs and the OR bed surface is 80 degrees to 100 degrees. The patient's lower legs are parallel with the OR bed. Hemilithotomy position, the patient's non-operative leg is positioned in standard lithotomy. The patient's operative leg may be placed in traction. High lithotomy position, the patient's hips are flexed until the angle between the posterior surface of the patient's thighs and the OR bed surface is 110 degrees to 120 degrees. The patient's lower legs are flexed. Exaggerated lithotomy position, the patient's hips are flexed until the angle between the posterior surface of the patient's thighs and the OR bed surface is 130 degrees to 150 degrees. The patient's lower legs are almost vertical. Trendelenburg's position. Trendelenburg's position involves lowering the head of the bed and raising the foot of the bed of the patient. The patient's arms should be tucked at their sides. Promotes venous return. Hypotensive patients can benefit from this position because it promotes venous return. Postural drainage. Trendelenburg's position is used to provide postural drainage of the basal lung lobes. Watch out for dyspnea. Some patients may require only a moderate tilt or a shorter time in this position during postural drainage. Adjust as tolerated. Reverse Trendelenburg's position. Reverse Trendelenburg's is a patient position wherein the head of the bed is elevated with the foot of the bed down. It is the opposite of Trendelenburg's position. Gastrointestinal problems. Reverse Trendelenburg is often used for patients with gastrointestinal problems as it helps minimize esophageal reflux. Prevent rapid change of position. Patients with decreased cardiac output may not tolerate rapid movement or change from a supine to a more erect position. Watch out for rapid hypotension. It can be minimized by gradually changing the patient's position. Prevent esophageal reflux. Promotes stomach emptying and prevents reflux for clients with hiatal hernia. Knee chest position. Knee chest position can be in lateral or prone position. In lateral knee chest position, the patient lies on their side, torso lies diagonally across the table, hips and knees are flexed. In prone knee chest position, the patient kneels on the table and lower shoulders onto the table so chest and face rests on the table. Lateral knee chest position can also be done prone. 2 ways. Knee chest position can be lateral or prone. Sigmoidoscopy. Usual position adopted for sigmoidoscopy without anesthesia. Patient dignity. Prone knee chest position can be embarrassing for some patients. Gynecologic and rectal examinations. Knee chest position is assumed for a gynecologic or rectal examination. Jackknife position. Jackknife position, also known as crusk, is wherein the patient's abdomen lies flat on the bed. The bed is scissored so the hip is lifted and the legs and head are low. In surgery, jackknife position is frequently used for surgeries involving the anus, rectum, coccyx, certain back surgeries, and adrenal surgery. Requires team effort. At least 4 people are required to perform the transfer and position the patient in the operating table. Cardiovascular effects. In jackknife position, compression of the inferior vena cava from abdominal compression also occurs, which decreases venous return to the heart. This could increase the risk for deep vein thrombosis. Support paddings. Many pillows are required on the operating table to support the body and reduce pressure on the pelvis, back, and the abdomen. Jackknife position also puts excessive pressure on the knees. While positioning, surgical staff should put extra padding for the knee area. Kidney position. In kidney position, the patient assumes a modified lateral position wherein the abdomen is placed over a lift in the operating table that bends the body. Patient is turned on their contralateral side with their back placed on the edge of the table. Contralateral kidney is placed over the break in the table or over the kidney body elevator, if attachment is available. The uppermost arm is placed in a gutter rest at no more than 90-degree abduction or flexion. Right lateral kidney position. Access to retroperitoneal area. Kidney positions allows access and visualization of the retroperitoneal area. A kidney rest is placed under the patient at the location of the lift. Risk for falls. Patient may fall off the table at any time until the position is secured. Padding and stabilization support. Contralateral arm underneath the body is protected with padding. Contralateral knee is flexed and the uppermost leg is left straight to improve stability. A large soft pillow is placed in between the legs. Kidney strap and tape are placed over the hip to stabilize the patient.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.